know 5 children will die today because of child abuse and neglect? This is from American SPCC, their article, Statistics and Information. Growing up the daughter of a children's services social worker, I have come to have very little respect for those who abuse their children. My mother, Sabrina Buchanan, is a social worker for Washington County Children's Services, and she once told me a story about a mother who had her children all taken away from her right after birth. The first 2 infants were born addicted to multiple drugs and showed signs of fetal alcohol syndrome, and they were taken from her as soon as they left Children's Hospital. The twins were required to be hospitalized for 3 months because of their drug dependencies and required the treatment of methadone. Within the 3 months of being in the hospital, the parents only came to visit them 2 times. The next baby was born less than a year later, and he was also addicted to drugs and likely had fetal alcohol syndrome. He had even more severe health issues than the first 2 children, and like the other 2 children, required a long stay in the hospital. After having 3 children born with drug dependencies, this woman had yet another child, and the same story is true for her as the other 3 children. This woman brought 4 children into the world who were forced to endure horrible suffering and will have disabilities for the rest of their lives. So what do you think? Should this woman be allowed to have more children to bring into the world to abuse and neglect? If this story hasn't convinced you, then hopefully these facts will. In 2015, the National Children's Alliance estimated 683,000 children suffered from maltreatment, and with the parents being the abusers 78.1% of the time. Oftentimes, parents mistreat their children even after they have been removed from their custody for a period of time. According to an article called Risk Factors for Occurrence of Maltreatment in 2006, previously abused children are 6 times more likely to experience repeat abuse. In 2011, the JAMA Network conducted research and found that of 2,578 children that were reunited with their caregivers, 44% suffered from repeat abuse in the 5-year follow-up period. A scholarly paper written in December 2006 called Families with Repeat Involvement with Child Welfare Services found that 20% of families required intervention after their first offense. Many times these repeat offenses are not isolated events and oftentimes result in the permanent removal of the children from these homes. The question is, should these parents be allowed to bring more children into the world that will be abused and neglected? Abuse and neglect does not just harm children at the time, it frequently follows them for the rest of their lives. As children, victims typically suffer from psychological disorders, behavioral issues, low self-esteem, and low self-worth. Through adulthood, these problems often still occur, but other difficulties can happen too, such as depression, suicide, and sometimes drug and alcohol abuse. In 2013, long-term consequences of child abuse and neglect found that males with 6 or more events in their childhood of mistreatment, it increases the risk by 4,000% for drug and alcohol abuse. A law to forced sterilization of unfit parents would need to be very specific. Guidelines would need to be set in place for how many chances the parents get. The more heinous crimes would obviously have less chances, and less severe would have more. Another area for this that could be looked at is the parents' willingness and effort to better themselves for their children. Obviously, not all cases are the same, so the law would need to be well thought out and in detail, but I personally believe a 3-strike law would be sufficient for most cases. A law of this nature we would see positive outcomes in many aspects of life. If these perpetrators were sterilized, it would help preventing future children from abuse and also save money for children already in foster care. This action could prevent bringing children into the world who will be forced to undergo a great deal of pain and suffering. If there was a 3-strike law, the mother I discussed earlier would not be allowed to continue having children and to abuse and cause severe delays and disabilities. By not allowing unfit parents to reproduce, less children would be in the foster care system and positive things could happen. Although the foster care system is great, it is not ideal or perfect, and this law could help reduce the number of youth in the foster care system and allow more time for foster parents to spend with each child. Another positive outcome is the money that would be saved could be used for the children that are already in the foster care systems. Many of you had probably never heard of this topic or never even thought about it, but the only way a movement like this could be taken seriously is for more people to get involved. We all have social media and we can all use it to our benefit, as it is one of the fastest, most efficient ways to get ideas across. Another way anyone can help is by writing letters to congressmen, representatives, and senators. And lastly, and the most important thing, is if a law like this ever comes to vote, be sure to vote for the sterilization of unfit parents.